Hello, my name is Dr. Denise Bronzino, and I'm one of the clinical directors for New York START in Region 5. The title of our poster is The Use of Mindfulness to Promote a Trauma-Informed Care Environment, a Case Study. For the purposes of this poster, preliminary data from New York START Region 5's comprehensive trauma assessments, part of a larger research project with Region 3, were reviewed, and it was striking just how many people referred for START services have a trauma history. The aim of this ongoing research is to better assess trauma so as to offer better supports and interventions, which led to the idea of the current case study examining trauma-informed care and the use of mindfulness for the purposes of informing our therapeutic supports. The IDD population is at an increased risk of traumatization compared to the general population, although it is underreported and/or underdiagnosed. Communication deficits and cognitive functioning have been offered as reasons. Our research is exploring the use of the UCLA PTSD-RI and LANCE for assessing trauma. Additionally, we examined the irritability scale of the ABC. Research has shown that trauma-informed care within environments may lead to a reduction of behavioral health symptoms, and the use of mindfulness as a strategy has been explored not only for the individual, but for caregivers as well.
Hello, I am Alyse Scura, the other clinical director for Region 5. This slide presents background information on the case we utilized. Allison was identified based on her history of multiple traumatic events, meeting criteria for a PTSD diagnosis, in addition to having scores on the ABC and LANCE reflecting difficulties with emotional regulation. The hope was that the combination of mindfulness strategies for both the individual and her primary staff would result in a reduction in anxiety and associated behavioral health symptoms. In order to promote a trauma-informed environment, the protocol began with staff trainings on trauma and trauma-informed care, followed by weekly mindfulness sessions with both residential and day program staff who were asked to document their pre- and post-stress levels. However, due to COVID-19, data could not be retrieved. A similar protocol was followed with Allison. However, she was provided with twice weekly sessions using soles of the feet meditation, where attention and awareness is shifted from an anger-provoking situation to a neutral point on the body, the soles of the feet, in order to more effectively regulate emotions and manage impulsive responses. This strategy has been used successfully with individuals with IDD.
Preliminary data from the trauma research is consistent with the finding that trauma is prevalent in individuals with IDD. 38 out of 40, or 95% of individuals, had at least one trauma event, although only 4 of these individuals had a trauma or stressor-related diagnosis. Most individuals identified multiple traumas, with bereavement, illness or medical, bullying, and separation being the most frequently reported. While the majority of individuals had high total scale scores, only 10 out of 38 met full criteria for a DSM PTSD diagnosis on the UCLA. In examining this further, a trend was noted wherein criterion C was not met with the greatest frequency. Cognitive and communication deficits, as well as the lack of choice or control, may impact the ability to adequately assess the internal or external avoidance in individuals with IDD. Finally, there was a positive correlation between the frequency and severity scores on the LANCE and the number of criteria met on the PTSD-RI, suggesting the potential usefulness of this tool in aiding the identification of trauma in this population. Turning to the case study, in utilizing mindfulness with Allison, she showed improvement in stress levels immediately following the meditation, although the impact on incidence of aggression could not be assessed given the COVID outbreak. Both staff and Allison utilized their mindfulness strategies between sessions and in fact chose to continue the sessions following the conclusion of the protocol.
The outbreak of COVID-19 forced a need to adjust our methods of support in our region. Given the success of the mindfulness protocol with Allison and her system, we wanted to reach other systems by providing support of this kind, which led to the development of over 25 videos for individuals, families, and their caregivers, ranging from conducting morning meetings, sensory and art activities, and mindfulness to education on topics such as anxiety and self-care. And from there, the Region YouTube channel was born.